While the United States may not have a specific regulation that addresses psychological health and safety, it does have a program focused on the whole worker, including their emotional and mental health. Get ready to learn more about the NIOSH Total Worker Health Program on this episode of the Psych Health and Safety USA podcast. From Flourish DX, this is the Psych Health and Safety USA podcast. Safety at work is more than freedom from physical injury. To be safe, you have to feel safe. Join us each week as we discuss psychologically healthy and safe work in the USA. Well, welcome to this week's episode of the Psych Health and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each week, we seek to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. Since this podcast has been on the air, we've talked a lot about the lack of a specific regulation to address psych health and safety here in the US. And while I still believe that, it'd be a good idea at some point, an important step for the country to have a regulation, there are some other ways to increase psychological health and safety that don't require regulation at all. Now, just for a little bit of context, the OSH Act, or the Occupational Safety and Health Act, when Congress passed it, it declared it to be its purpose and policy through the exercise of its powers to regulate commerce amongst several states and within foreign nations, and to provide for the general welfare, to assure, so far as possible, every working man and woman in the nation safe and healthful working conditions. A lot of times when we talk about the OSH Act, we think more so about OSHA and don't remember that there was another organization created virtually at the same time called NIOSH. And our guest today is a representative of that organization. There is, as a matter of fact, in 2011, NIOSH created an activity or a program that they call Total Worker Health. And it's committed to developing knowledge, focus on the integration of occupational safety and health and the promotion of health as well. So I again, a lot of the information I know about Total Worker Health, I kind of looked up because to be quite honest, even as a safety professional, I can't say that I knew that much about it. So I reached out to the folks. You reach out to the federal government, and sometimes they actually answer. And in this case, I do have to give credit where credit is due. I reached out to NIOSH and I got a response like the same day from the director, as a matter of fact. And he forwarded me to our guest today, and she's going to help all of us understand a little bit more about the Total Worker Health Program and some of the other activities going on at NIOSH. But enough about that. My standard introduction to guests on the podcast is this question. And for our guest today, so who is Chia-Chia Chang?
Good question. Hi, I am Chia-Chia, pronounced just like the dance.
Okay.
I'll start with now. I am the coordinator in the Office for Total Worker Health, and I'm also a coordinator in the NIOSH Healthy Work Design and Wellbeing cross-sector. I lead collaborations to share research and promising practices for advancing worker safety, health, and well-being. I guided the development of a worker well-being framework and the NIOSH Worker Well-Being Questionnaire, the WellBQ. But to get more personal, in my previous work in NIOSH, I've always been in the office of the director. I've done a diversity of things. I led enrollment and outreach for the World Trade Center Health Program. I was liaison to the National Advisory Committee on Occupational Safety and Health, NIOSH. I was assistant program portfolio for the emergency response portfolio. And prior to joining NIOSH, I did disability and health policy at the Social Security Administration.
Wow. That's quite a bit. As a matter of fact, we had opportunity to meet in person at the National Safety Council Congress.
That was nice.
A little bit ago. It was good to see real people, and to see that you're a real person and have obviously been involved in this work for a while. So tell me, when you hear the concept, the phrase, the idea about psychological health and safety, what does that conjure for you? What do you think of when you hear that?
I think it's about feeling literally safe in, well, I'm presuming you're saying sort of in the workplace. I would say it's feeling safe in the workplace to say and do what you feel like you have to do. But in general, psychological health and safety is, feeling like you could speak without worrying about retaliation or being bullied. It's a very broad term, so it's a great question. There are people who've started thinking about this. Canada had a voluntary standard. You talked about, there's no mandatory standard, but Canada had a voluntary standard, and they talked about in the voluntary standard, they actually list very basic human needs like self-worth, self-esteem, autonomy, social justice, belonging, and self-efficacy or accomplishment. I mean, that is really, really basic. And I think it's great that it's actually identified, because I think for people to feel safe and healthy at work, physically and psychologically, you really need to have those very basic human needs met. And then there's other ways of thinking about it. The American Psychology Association says you should also have employee growth and development, have employee involvement in your decision making, and of course recognize employees so that people feel seen and appreciated, which is very important for our psychological health and safety. And of course, they also point out, the importance of having health and safety and the basics of workplace safety and health that the OSH Act talked about. Thank you for covering that. And
Sure.
having, work-life balance and management. So it's a very broad term, but it's not completely, we're not just out in the woods trying to figure things out. There are things that have been put in writing to help us identify what's needed and the way that workplaces could create safe and healthy places to work.
Sure. Sure. So if you and I want to make sure that our guests know that because you're here representing the federal government, and something the government does is that I think we all realize that it's not a perfect scenario, and there will never be a perfect scenario, particularly as it relates to how people feel psychologically. I don't think that's possible. It could certainly be better. So what is your kind of general assessment of the state of mental and emotional health in workplaces across the U.S. Just in general, no specific industry, but in general, where do you think we are?
That's a great question. Unfortunately, it seems like we're not doing so well at this moment.
Mm.
The pandemic could have something to do with it. I would love to have this conversation again in another year or two and see if, as we're coming out of the pandemic and things are even more back to normal, whether things are better. The American Psychological Association last year had a survey of psychologists, and they found that almost a third of them were seeing more patients since the pandemic started. And they reported almost three-fourths of them said there's been more demand for their services. I think it is good that people are seeking care, and I think it's great that people are being open and identifying the need to seek care. So that is very good. They also found that there's just more depressive episodes and more trauma and stress-related disorders and sleep-related disorders. And that's again just from the survey of psychologists. So those are only the people who know about people who sought care. If you think about all the people who are having mental health issues who haven't sought care, I think that would be a lot more, unfortunately. The
Mm.
good news is I do think it's great that there's more recognition of it. The UK, the Prince, not Prince Charles, I think it's Prince Harry and Prince William, they've got initiatives to really get people to start talking about mental health and being more open about it. And there's more recognition of that too in the United States. The Surgeon
Yes.
General has had a couple of initiatives about that and is still working on it. So I think that's great news that there's more understanding, more openness, there's less stigma, and hopefully that'll lead to more understanding of the issues that people are going through and sort of being more accommodating in a not regulatory way, but just literally giving people some slack, saying, I know you're going through a lot. I'm going through a lot. We're going to go through it together.
Yes. Yes. No, I honestly, while you were speaking, something it popped into my head. Again, because you're a federal worker, I remember something uh, after the presidential inauguration. So the president was inaugurated, and he went into, I forget, I think he was having a conversation with some federal staff, and he said something that really struck me. He said that, he wanted to make sure that people who were working in the federal government, that if he found out that people were being bullied, harassed, and mistreated in the federal government, that he'd be taking action right away. So I interpreted that as a statement. He obviously can't be everywhere, but having that kind of statement come from the president or from the top of any organization, that's encouraging, because at least at the top, people are thinking about this. You can't solve a challenge or an issue you won't even admit exists. And so I thought that was a really important statement for the president to make. And that's on top of, though, a program that apparently has been around for a while that we really want to get into detail about, because how you're treated at work does affect how you work and how you feel at work. So if someone catches you in the elevator or stops you on the street and says, well, so what's total worker health? What does that mean? How do you respond when people ask the question about what is total worker health?
I think the simple way I personally respond is it's really focused on all workplace policies, programs, and practices that relate to worker well-being. So in public health, that may not be your background, but in public health, there's a sort of a framework where they say health in all policies. So in community health or population health, it means, not having food deserts. So there's not just fast food, but there's access to farmers markets, fresh foods. It means having healthy transportation options and it includes things like, social determinants of health, where you look at socioeconomic status and race and ethnicity and all the things that relate to health and well-being. And total workout applies those things to the workplace. So when you're designing your HR benefits, you keep health in mind. When you're, designing buildings, you're thinking about, is this good for our work well-being? When you're thinking about paid leave or salary or even hiring people, you think, is this person going to contribute to the well-being of our workforce? So that is how I phrase it. A couple of key things just to point out, because that was a lot, is one, total workout is really focused on the upstream systems approaches. So we're not trying to change behavior one person at a time. We're trying to go upstream to, as you said, the leaders, the supervisors, the management, the written policies, and the unwritten program practices that impact well-being, so that we're like with social determinants of health, we're addressing things that are sort of beyond the individual's control and lifting the burden on off of the individual worker and saying, we recognize that this is making it difficult for you to have psychologically health and safe workplace. This is what we're going to do to address all the things that would make your life easier and healthier. You've had some training in occupational safety and health, so you know about the hierarchy of controls, and we would apply that to health. The hierarchy of controls, for your listeners who are not worker safety and health experts, that talks about having different levels. The top of the hierarchy is the systems. So for like something like asbestos, the best way to not have asbestos related disease is to not use asbestos. Best option, right? To eliminate it. But then sometimes there are times when you need to think something that has the characteristics of asbestos. So then you can have substitution. Or then if you need to have it, you can have engineering controls. Like with the pandemic, people talk about ventilation. And then down at the bottom of the hierarchy is individual changes. Like if you're a asbestos cleanup worker, you can't tell them to not be exposed to asbestos. That is their job. You can't tell a firefighter to not run into a burning building. That is their job. So at that point, then you have the personal protective equipment, which we all now are very aware of with a mask and stuff. So we would do the same thing for health. We really want to say, what is the workplace doing that could really eliminate health hazards And then also as part of the toolkit, you do have the individual interventions. So total work health is about all of that with a particular emphasis and priority on systems and upstream approaches.
Yeah, I think that's very important. We have, at least my experience anyway, is we have a almost a societal, when we start talking about individualism, we tend to look at everything on the individual basis. Oh, it's that person, it's that individual, it's what's going on with them. And that also contributes to, one of, and I give credit to one of my earlier guests, clued me in on this fundamental attribution error thing, where we simply look at the person and that's all about them. There are some things about being a human, and particularly being a human in the United States, that one person cannot fix. They cannot. Doesn't matter how much money they have, how much power they have, one person cannot resolve this. And honestly, I agree. To me, that's the purpose of government, is to be able to address systemic things that we as individuals can't really fix, to include the workers' health, and how we contribute to an effective economy. So, and it sounds like total worker health has actually been around for a while. It's not necessarily a new concept. I read a little bit about it, but can you tell me about, so you've been involved for quite a while. Tell us a little bit about how we got here.
Yeah, sure. Thanks. I want to follow up on one thing you said about the government. Yes, absolutely. We're very glad to have this initiative and love all the attention and interest in total work health. But of course, we're not doing it ourselves, right? We are not OSHA, like you said. So NIOSH is part of the CDC. We make recommendations that you could choose to listen to or not listen to. And we're encouraging workplaces to be involved, to put this into practice at work. We would love for workers to bring this to their workplaces for leadership and management. So what we're doing is getting the word out. And thank you for your support in doing this podcast. It helps get out the word, because we think it is up to the individual companies or business alliances to do this. And yeah, you're right. There's been decades of research on this. NIOSH has had decades of research on organization of work. That is, how is work designed to be healthy for people? Industrial and occupational psychology has been around for decades. The Total Work Health program actually kicked off way back in 2003, when the Secretary of Health and Human Services had a Steps to a Healthier U.S. Program. So the NIOSH developed a Steps to a Healthier U.S. Workforce. And that was back in 2003. And that was part of this initiative where we focus on the workplace. Then in 2005, that sort of evolved into the Work-Life Initiative, which was looking at overall worker health and how to have better work-based programs and benefits. And then the current iteration was in 2011. We renamed Work Life to Total Worker Health. We literally sat in the room and we're trying to figure out, what should we call it? Should it still have the work life in it? How do we name this? And that was the latest iteration, and we ended up getting a trademark for it, because the term has been so in such wide use. It's great. It's great to see all the acceptance of it. And actually, then in 2015, based on feedback from stakeholders, we evolved the definition a little bit. The name is still the same, but previously the definition was very specific, and people weren't understanding that we were talking about all workplace policies and practices. So in 2015, we modified the definition to make it more explicit that we're interested in all types of workplace policies, programs, and practices. And I'll say one thing, the official definition when we talk, I say, workplace policies, programs, and practices. Practices to me are the things that is unwritten. You're in safety and health. We've got the safety and health management system. It's all written in policy. But we know that that may not be what happens in real life. And that's where the practice gets in, the culture and what are people really, really doing. And so that brings us to our current iteration of Total Worker Health. We, as you know, at NIOSH, we have occupational research agenda. So in 2016, we published a research agenda for Total Worker Health. And at NIOSH, we do our work by sectors, like industry sectors, mining, construction, healthcare. And then we also have cross sectors, and total work health is in the cross sector for healthy work design and well-being. And that cross sector also publish a research agenda. And current program, Total Work Health, we do research intramurally and extramurally. We fund 10 centers of excellence. And we do translation activities. We've got webinars, newsletters. We've got the Total Work Health Third International Symposium next week. And we also have an affiliate program. It's a non-funded program, but it recognizes organizations around the country that are interested in total worker health. And it's a good way for them to learn from each other, and then to work and connect. So we continue to build on the research that we've done. The latest thing we've done is last year we released the NIOSH Worker Wellbeing Questionnaire, which you mentioned, that can be used by workplaces to assess the well-being of their workplace. And we continue to grow, and NIOSH does too. A few years ago, NIOSH created a National Center for Protective Aging, Nancy Paul, and that is sort of housed within Total Worker Health. NIOSH also has an opiates and workplace support and recovery program. Again, that's led by the director of Total Worker Health. We have a Future of Work initiative, and that's also got Total Work Health written all over it. So we've come a long way. We really appreciate all the interest that there is. And we think working together with our partners, we could continue to really grow the field and continue to get more people to understand how to bring psychological safety and health to their workplace.
Wow. Wow. I honestly had no idea. I had no idea that there were that many facets of the total worker health process. But if you think, it kind of makes sense. I mean, there are, I think last numbers, roughly 160 million people out there doing work in all kinds of different varieties. And all these environments are different. I mean, there's some similarities, but there are a lot of differences. And total means total. I mean, I think there has been, in the country, a lot of focus on physical injuries and things that we can, see, and things that look, particularly the safety community. I shared this at a recent presentation. I mean, so back in the early 1900s, we were seeing, I think the number was like 23,000 people dying in the workplace every year. And folks probably thought that was, that's just was part of the cost of doing business. And now we're well below 5,000. We're not to zero. We may never get to zero, but we're continuing to get those numbers down. I'm encouraged now to see this conversation around the things that you cannot see. Total worker health is not all that visible sometimes. You see the consequence, but people don't notice, how, particularly psychological things, how they affect people and they do their work. So and you talk a lot about just the expansive nature of NIOSH. So why does something like this really belong in NIOSH?
Absolutely, because I love that you read the OSH Act, and I don't remember the words, but it does specifically say it is for the welfare of workers. I should have the quote on hand. But when you were reading it, I was like, you're right on, and I'm glad you read it because you read all of those words. It is for the welfare of all working people. Right. And it doesn't specifically say, oh, we're just interested in musculoskeletal disease. It is all of the welfare of workers. And the numbers in occupational safety and health were always citing the number of injuries that are work-related, the number of people who die per year. And then one time we had a partnership with NIH, and I was looking at, it was the NIH's National Heart, Lung, and Blood Institute. So I was looking at lung disease and heart disease, and their numbers were so much bigger than ours, right? So when we're talking about burn, it's sort of small compared to the burn of heart disease. But how much of that is related to work? That is the question, right? Yes. The WHO just last year released these infographics on long work hours. Working 55 or more hours per week had like a 17% greater chance of having like heart disease, and something else was also 2 types of heart disease. And then working long hours killed, I think it was 750,000 people per year. And that was more than the people who died of like air pollution. That was more than the people who had an occupational injury. So I think this question of what is work related needs to be a lot the answer needs to be a lot broader. Previously, it was like, well, you got injured at work physically, so that's it. But when it's a moral injury, when it's a psychological injury, how do you take care of workers in that way? So this broad approach, I think, better meets the needs of workers in this world. And now work is changing, right? Previously, you very much went to an actual place to work, but now if you're working at home, how do you define workplace? Or when you have part-time workers, all those in-car shoppers and Uber drivers who helped us out during the pandemic, who is their actual employer? Who is taking care
Mm,
of their health and
mhm.
safety? So as work changes, we really need to think about how are we defining worker well-being, and how can we ensure that we're taking care of workers no matter how they're working or where they're working or when they're working or who they're working with.
Yeah, it was really exciting to hear that you have a future of work discussion going on around total worker health because well, I consider myself a futurist. I don't have any formal education, but I hang out with futurists sometimes and they say I can call myself, so I do. But I really believe that as we have gotten better on the physical injury side. So the number of deaths have declined, the number of non-fatal injuries have declined. We're getting better at the built environment. It is safer and
Yeah.
so on and so forth. But the thing we cannot eliminate, at least I don't think it's eliminated in my lifetime anyway, is the psychosocial hazard exposure of the people that we work with, the environment, the temperature. I mean, my grandma was sick. I mean, my bills are due. It's all these other things going on in people's heads.
Yeah.
And that comes to work with us. You can't just leave it at home. And sometimes it is at home because work is being
Mhm.
conducted at home. And so what do you share with people who say, look, I'm just so focused on this physical stuff. I'm not sure if that total worker health stuff is important to me. Why should I be interested in that? What would you share with them?
There's definitely data who shows that it is related. There's one study on neck pain, and it found that people who reported who had a greater likelihood of reporting worse symptoms of neck pain also reported psychosocial hazards such as job insecurity, working long hours, negative environment at work in terms of their supervisor and their coworkers. So those psychosocial things actually resulted in people reporting greater neck pain. So even when you're talking about something physical, you got to look at the things that are less tangible, but that are still very important. And there's definitely studies that show that the more people feel like they're being supported at work, the better the health outcomes. One of our centers of excellence has a supervisor training, and they found that people who went through the training, the people who report to them, they reported better health outcomes, better job satisfaction, and that is what we all want, right? We want workers to be healthier and happier. And so there's definitely studies that link worker well-being to better organizational outcomes, and it is all related.
Sure. So let's say and particularly I have a soft spot for small business because I am one. But um, so let's say I'm an organization who, I just heard about this total worker health thing, and I really don't know where to start. Where should I start if I wanted to get into the total worker health movement? Where would I start?
The first thing to do is to get leadership buy-in. You need leadership commitment. That is essential, and it needs to be at all levels. At least eventually, it needs to be at all levels. Maybe it takes a while for people to get buy-in, but you need to have leadership buy-in, and you also need to have worker buy-in too. So it can't be top down. You need workers involved, so that whatever you're going to do, workers are at the table, and you're not just unilaterally deciding things. And then you would want to have probably like an assessment, some sort of way to identify your priorities. What issues are workers seeing? What concerns do they have? And then have this integrated approach of bringing all people to the table. I talked about the health and all policy. So all sorts of decision makers at the organization who can make an impact on anything need to be involved. And then in doing all this, you've got this, leadership support, you've got an integrated system, you've got worker involvement, and of course, you got to keep workers' information private and confidential, and make them and let them know that it's voluntary their involvement. They're not being forced to do anything, and have working engagement. But I want to make sure we don't think that before you start all this, you got to have the safety down too. So if people are dying and getting injured, definitely positively take care of that. And so that's it. So have leadership buy-in, have worker involvement, and then identify for yourself what your priorities are. Because people come and they're like, what do I do? I'm like, it's up to you. It's up to your organization, what's important to you, what issues you're facing. And if you're talking together, you can identify it. And by this integrated approach, it could be many things. Our webpage has this long list of issues, but it identifies, different buckets, and it could be things like, like you said, the built environment. It could be compensation and benefits. It could be organization of work, that is the autonomy and flexibility you have. It could be work arrangements. How is work designed? Do people get control and flexibility over their own schedules? And it includes things that, the demographics. Are people, is there a culture of diversity, inclusion, accessibility, and equity? And of course, maybe community support. How are people able to take care of their families, and how are people interacting in the community? So in a company, those things could all relate to well-being. So that's how I would get started. Have an assessment and have all the people at a table.
So I'm thinking about, again, all of these ways that NIOSH is looking at total worker health. Uh, it's very expansive. It really is, and it's really good to know that there are folks, in the United States, particularly in our government, who are kind of focused on this. You mentioned early on, though, that you all are looking over the fence at what's going on in other places. Now again, I will admit that I'm a kind of a fanboy, if you will, of these other places around the country. This podcast is sponsored by a group out of Australia, and I've met some really interesting folks from Canada and the UK around this issue. But so do you all have discussions, conversations with other countries about what they're doing? Or is this, I realize this, kind of has to be focused on here in the US, but what kind of, interactions do you have with other folks around the world around this topic?
Yeah, definitely. We interact with them as much as we can and learn from them too. So yeah, you're right. Canada has a voluntary standard, UK has a voluntary standard, and we were part of this international working group to develop ISO 45003, which is a voluntary standard for psychological safety and health in the workplace. And yeah, Australia, I think we've we've definitely spoken with them. There's been interest from all around the world. And yeah, there's different perspectives. Some people could be, just getting to it, and some people we're learning from. And I think it's very exciting to hear about the things that are going on. And I think in other countries, I just found this out from a psychologist who had worked on the ISO 45003. He was saying in other countries that don't have employer-sponsored insurance, their employers sort of has less leverage, right? Because here, employers sort of have to care about workers because they're paying for their healthcare lots of times, or they're contributing to their healthcare. In other countries where they don't have that, then what reason do they have to care about the worker health?
Hmm.
But it was pointed out to me that because of that, they can move on to other things, such as the psychological safety, because they can't, they're not controlling the healthcare thing. So they're like, what else can we do to help workers? So that's why they're able to move on to that. And there's an initiative in safety where Vision Zero, ESO does that, and they're trying to have zero injuries. And the question is, once you get to zero injuries, are you done? No, there's more we could do. And that's where you can continue to expand and continue to learn from each other.
Yeah, in my, in the research I did a little while back, my definition is slightly different than some of a psychosocial hazard. Again, is a psychosocial factor that's perceived or experienced by the person as a threat, that in turn drives or motivates their behavior. And from that view, you will never get to zero, ever. It's not possible to get to zero, because where you may feel safe in that environment, I may not. Where I may feel safe, you may not. And frankly, I felt safe today, and then tomorrow something changed and I feel a little bit different. And so that's why I really believe that this whole conversation about psychosocial hazard mitigation is just limitless. It's endless in terms of what our focus has to be. And I really like the point that you brought up earlier about, because I think sometimes organizations, they get almost overwhelmed by the fact that it's so much. Well, it's so much, but it only affects you in certain ways. You have X number of people, X amount of resources. You can only do what you can do. And every journey begins with starting. You just have to start. It's having this focus that says, I do care about the total worker health. It also is interesting. I hadn't heard that perspective, that because we have an employer-based healthcare system, that people should care, because it's interesting, as a safety professional, I find a lot who just don't seem to get that. So you're paying for these folks' healthcare. It doesn't seem to bother you that they have all of these days of, so there's I think general industry in 2021, I believe the average for every 100 workers, 3 of them were going to get injured. Are you okay with that? Because those 3 people can bankrupt you if they get hurt bad enough. So I find that really interesting, that folks aren't even seeing their own interest in taking care of other people. So again, a business gets interested and they start the program. So tell us a little bit more about some of the training and education that's out there that's available, because you talked a little bit about these centers of excellence. How can people get more information and training and education if they are on the journey, they want to get better?
Oh, there's a lot of stuff. Within NIOSH, we have quarterly webinars. Actually, we have more webinars beyond that. Total Work Health is quarterly webinars, and then the cross-sector program for healthy work design is now having some webinars. Future of Work has webinars. There's a lot of webinars. And then NIOSH has quarterly newsletters. And then, yeah, we fund 10 centers of excellence. They do the same things we do. They do research, practice, and part of their mission is to also do training and education. So many of them have their own webinars and newsletters, and then some of them have special events. So I think the Harvard Center definitely has an in-person 2 or 3 day training as part of their continuing education. Oregon also has a summit every year that's in person or virtual. That's multi-day that you could learn from. So, you can do the quickie things, you could do the long things. And then like the Midwest Center of Excellence and the Oregon Center both have podcasts. The Midwest Center of Excellence has short little videos, just like 5-minute videos, just to help you. It's got a little toolbox talks. And then, some of them have new events, just like I said, next week we've got our international symposium, and then there's also, for people who are really committed, there's also degree programs. There's online certificate programs, and the University of Texas, an affiliate, they actually have a PhD program in total work health, so you can actually get a PhD in it. And next week, they sort of announced it, but there's now going to be a professional society for total work health. So, you've got your ASSP, you've got your AIHA, you've got your SHRM, and now there will actually be a professional society for total work health. It's just getting started, and everyone should definitely learn more about it.
Wow. So, and it sounds like there is everything from soup to nuts. Because again, Jen, as I said, I tend to be an advocate for the folks who don't necessarily have the money to fly to a thing or to travel to a thing. But it sounds like there are a lot of resources that are just available free of charge, and everything from free of charge information to a PhD and everything in between.
Yeah, absolutely. And most of the webinars are archived online. So of course we're all busy. So you could always listen to it at your leisure too. And
Sure.
at least for the NIOSH Children Work Health webinars, they also provide continuing education credits too.
Okay. So we've established the program's been around for a while. It's not really all that difficult to, first of all, you got to get, both workers and leadership involved, and there's all this training out there. And are there places that you've seen that have, not, you don't even necessarily have to give names, but unless you want to. Have you seen some folks who really just nailed this? They've done a really exceptional job. So these centers of excellence, it sounds like they're more education focused, or are they examples of what what total worker health looks like?
Oh, thank you for that. To be clear, yeah, no, centers of excellence are university-based organizations. So they're mostly doing research, but they are a great source for those promising practices. So each of their interventions would then be a good example for an organization that's doing well, right? So like the supervisor training I talked about, that was by the Oregon Center of Excellence. They created this training and then they went to workplace and were able to implement it. So the Centers of Excellence are great resources for examples of interventions that worked. Those are mostly, just the interventions that they tested because they're researchers. We're, like you said, we're not going in implementing everything all at
Sure.
once. Those are great examples. And then there are also case studies. So by some of the centers, Health Links, the Colorado Center of Excellence has a lot of case studies from the organizations they've worked with. The Oregon Center of Excellence has also case studies on their webpage. Harvard also has a case study on their webpage. And on our NIOSH webpage, we also have promising practices. So like a few years ago, we featured Dartmouth Hitchcock because they really were getting it. They brought in people, they were surveying teams and asking them what was important, and they were creating integrated interventions. And so we featured Dartmouth Hitchcock, which was also a Harvard promising practice. We had, identified a few years ago the Bend, Oregon Police Department because they were doing great things. They're giving people time at the end of their shifts to decompress. That's paid time to do it, and that's also promising practice for the Oregon Center of Excellence. And then our webpage, promising practices, included others such as Johnson and Johnson, Leidos, and the most recent one was, I think, the NOAA, National Oceanic and Atmospheric Administration. They now have, within one of their divisions, they actually have a director for total worker health. So they got their employees, actually they're implementing total work health. So yeah, there are examples out there, and we hope to learn more about what other people are doing. So if your listeners think they're doing something great, please let us know because people want to know about it.
When I thought about having you on, or having someone from the program come on, this is exactly what I was hoping I would hear. Because, as I said, a lot of what motivated me to get involved in this whole conversation about psychological health and safety was the lack, was the fact that, it just didn't appear, that there was a lot going on. And it is actually encouraging. There is a lot going on, but, like a big complex country with, 330 plus million people, it is difficult to get the word out to everybody. And so I'm hopeful that, folks will, just kind of, at least my listeners, and they'll pass on to other people that we do have some things going on. So as we start to wrap this up, as I mentioned to you, I'm a bit of a futurist. Let's say we're having this conversation 10 years from now. And let's say, we're going to imagine here, money's not an object and everybody agrees. So we're 10 years from now. What do you see total? What does that look like 10 years from now? How far have we come? What does it look like in the United States, at least from your vantage point?
Well, I would like to be more optimistic than you. I don't want to think that it's hopeless, that there will always be hazards. I agree that it is subjective, but I think it's possible for us to actually have healthy workplaces. For one thing, I'll say one thing about the subjective thing. The National Worker Wellbeing Questionnaire, you're right that there is subjective aspect. So it's not just like, if only you would just become more resilient, you would be fine, right? There's also an objective things. All the studies that show people of different, whatever, socioeconomic status have different health outcomes. So the vision would be that people are actually working in places, virtually or physically, that actually help their well-being. They're appreciated by their supervisors and their coworkers. The work they do is meaningful, the work they do is recognized, their achievements and contributions are recognized. They enjoy the camaraderie and support of their coworkers and supervisors. They're paid a good salary, so they don't have to work multiple jobs. The working hours are nice, so you could spend time with your family and friends. You have a social life. You have a whole life outside of work. And you have time to exercise and be healthy because your work is not so stressful. And your work, whether through work or something else, you have the health coverage you need to get the care that you need, whether it's physical health or mental health care. We're all sleeping well. We're all relaxed. We have just the right amount of pressure for us to feel motivated, but not enough to kick off any stress hormones. And we recognize that work, just as with hobbies and exercise and being with loved ones, contribute to our well-being, and work is actually healthy and something we look forward to.
Wow. Yeah.
Maybe that won't be done in 10 years.
Well, all things are created twice, and the first place they're created is in our imagination. I think it's really important, just because if we can't imagine what that looks like, we'll never be able to work towards it. And I have to tell you, I feel encouraged. It's neat. I mean, it's neat to, like I said, it's just neat to know that folks are working on this. And as I try to be a realist. It may not be 10 years, maybe it'll be 11.
Good answer.
But yeah, but it is good to know that you and the other folks at in the program have these kinds of views and are even able to share them publicly, because, some might call that pie in the sky, but I don't, I believe that anything that this country sets its mind to do, it can do. It can. I do. I believe that. I'm an optimist that way. The question is whether or not we want to or not, and as I say so often about safety related items, some people do them because it's just a wonderful, right thing to do. Some people do it because it's, they're kind of tired of paying for the negative consequences. And some do it because they have to. And it doesn't matter to me which one you pick. As long as we get there, that's.
It would be nice if got back to sort of recognition of the importance of this. I hope that it's not just workers and management, but the general public is thinking about this. So we say you should have good work well-being, so that helps you recruit people. If your company has a good reputation of treating their employees well, people want to work there. And it would be nice if the general public thinks about that too. You're like, oh, which company should I shop at? Which company treats its employees well? That's the company I want to patronize. Or for investors, when they're investing, they don't just look at, whatever environmental pollution or actual profitability. They also look to see, is this company treating its employees well? Because that, of course, is going to help the company become more sustainable. So I think if there's recognition of these things by literally, the general public, we can make more inroads.
Yeah, I've started this practice since I did my research, particularly when I go to restaurants. So we'll sit down, we'll have a nice meal and all that, and I try to get around to asking the person who's serving, what do they think about working here? And I'm real clear with them, that if they don't feel that they're being treated well there, they won't have to worry about me coming back. Matter of fact, I'll go to their manager and share with them how important it is. I want to give my money to people who are treating other people well. I do.
Wow.
I do.
Wow. That's right.
I do. And I think if we all did that, it'd be great for all of us, because why would I support someone who's mistreating you? Because if they'll mistreat you, they'll also mistreat me.
Exactly.
And, the way I'm going to get great service is to have other people be treated well. That's it. So like I say, it's actually a pretty selfish thing. I want good stuff, so I want you to be treated well so I can get good stuff. So yeah, this has been just a really, as I said, it's a really encouraging conversation about what's going on. As a matter of fact, I'll probably have to, have you back later to find out, some of the new things. I particularly be interested in that whole future work group. So, matter of fact, if we can, kind of, I might have to follow them, because they're just really into the what we do next. But Cha-Cha, thanks so much for spending some time with me, with sharing, what's going on in total worker health. I've certainly been encouraged and informed, and I think my listeners and those who are watching have also had the same experience. Again, for those of you who are checking in, we're here once a week. We have new episodes come out every week, and you can catch us, wherever you get your podcasts. And we're just thankful to the folks at Flourish DX for sponsoring us, and for this community of people I'm starting to meet all over the country who are really interested in psychological health and safety and the total work environment that, again, Cha-Cha, as you described, let's work towards that time when we all feel like work is a wonderful place to be. So again, thanks very much for joining me today, and thanks for all of you who've tuned in. And that's it for this episode of the Psych Health and Safety USA podcast. We'll see you next time.
You've been listening to the Psych Health and Safety USA podcast. To stay up to date with the best content on workplace mental health in America, subscribe wherever you listen to podcasts, and join the Flourish DX community at www.flourishdx.com.